All right, so get ready, everyone, because today we are diving deep into something that every dog owner out there should know about,
Oh, absolutely.
canine distemper.
Yeah.
And for this one, we're going straight to the source, pulling out the latest from vet journals, clinical handbooks,
Straight to the
and
experts.
like your dog owner's survival guide, all distilled down into about 8 minutes.
You know you're not exaggerating about that survival guide part. Canine Distemper virus, or CDV.
Okay.
It is a serious and unfortunately a pretty widespread threat to dogs, both domestic and wild.
I gotta admit, the name distemper, it always kind of makes me think of like a dog having a little bit of a mood swing.
Right.
But sounds like we're talking way more than just like a bad day for our pups.
Right. It's a highly contagious and potentially fatal disease. It's caused by a morbillivirus.
Yeah.
And get this, it's in the same family as the virus that causes measles in humans.
Whoa, hold on, wait a minute. Measles for dogs. That suddenly makes this a lot more real for me.
Yeah.
So how does this canine measles actually spread? Is it like a sneeze and you're doomed kind of thing?
Well, it is airborne.
Okay.
So those tiny droplets from a cough or sneeze, definitely a major transmission route.
Yeah.
But it's not quite as simple as one sneeze and it's over.
Got it.
Direct contact with infected fluids,
Okay.
like saliva, urine, even feces can spread the virus too.
Oh, okay. So no sharing water bowls at the dog park then.
Right.
What about all those adorable puppy kisses? Is that a risk?
Unfortunately, yes.
Wow.
And it really highlights why keeping your dog's vaccinations up to date, especially those puppy shots,
Yeah.
absolutely critical.
It makes sense.
Yeah.
So let's say a dog is infected. What kind of signs should owners be looking for? Is it obvious? Or does this virus kind of like play hide and seek?
It can definitely be a bit of a chameleon.
Okay.
And the symptoms can really vary depending on what systems in the body are affected. Often starts out mimicking a really bad cold, talking, like coughing, sneezing, maybe discharge from the eyes and nose.
So just like us humans, when we're coming down with something,
Right.
but it doesn't stop there, right? There's got to be more to the story.
Unfortunately, yes.
Okay.
Along with those respiratory signs, you might see gastrointestinal issues,
Okay.
like vomiting, diarrhea, loss of appetite. And here's where it gets really concerning.
Okay.
CDV can attack the central nervous system.
Oh, wow. So it's not just a physical illness. This is impacting their brain too.
Exactly. We're talking potential seizures,
Rush.
paralysis, muscle twitches, even a unique kind of seizure, sometimes called a chewing gum seizure because of the way that the jaw moves.
Huh.
And the scariest part,
Yeah.
even if a dog seems to recover, there can be long-term neurological damage.
Wow. Okay. So this just went from 0 to 60 real quick.
Yes.
So we've got potential respiratory issues, stomach problems, and even brain damage.
Yeah.
No wonder this virus is considered so serious.
Yeah.
So who's most at risk here?
Puppies, without a doubt. Those between 3 and 6 months old are especially vulnerable.
Okay.
It's that tricky time when those antibodies they got from their mom's milk start to wear off
Oh, right. Yeah.
and their own immune systems are still developing.
Yeah. So it's like a race against time to get those little ones protected with their own vaccinations.
It is.
Really makes you realize how vital those early vet visits are.
Oh, for sure.
But let's say an owner notices their dog is showing some of these symptoms. How does a vet go about actually diagnosing CDV?
Well, it's not always straightforward.
Okay.
The symptoms can mimic other diseases,
Okay.
so vets have to play detective a bit.
Right.
Blood tests that look for specific antibodies, one tool.
So it's like a bloodhound sniffing out clues in the dog's immune response.
exactly.
What other tools are in the vet's detective kit?
Sometimes vets will examine cells under a microscope, looking for what are called viral inclusions,
Okay.
basically clusters of the virus hiding out inside the cells.
Oh.
And in some cases, they might use advanced tests like PCR to actually detect the virus's genetic material.
That's pretty high tech.
It is.
It sounds like vets have a whole arsenal of tests to really pinpoint whether it's truly CDV.
Yep.
But what about treatment? Is there like a magic cure once this virus is diagnosed?
Unfortunately, no.
Okay.
There's no cure for CDV.
Okay.
But early diagnosis is absolutely critical.
Okay.
Because it gives the dog the best possible chance. Treatment focuses on managing the symptoms and supporting the dog's immune system as it fights.
So it's all about giving their body the best fighting chance. What kind of support are we talking about?
It can involve hospitalization,
Okay.
especially for severe cases.
Okay.
Think 4V fluids to combat dehydration,
Okay.
antibiotics to ward off secondary infections, and medications to control those scary seizures. And there's sometimes discussion about using corticosteroids to reduce inflammation, but that's a decision best made in consultation with the vet.
It sounds intense and pretty scary for any dog owner to go through. Definitely one of those an ounce of prevention is worth a pound of cure situations. So let's dive into prevention. How do we shield our pups from this nightmare scenario in the first place?
The absolute best weapon in our arsenal, vaccination.
Okay, so vaccines are king, but how do they actually work?
Think of them as a wanted poster
Okay,
for the dog's immune system.
right.
It introduces a weakened or inactive version of the virus,
Okay,
which triggers the immune system to create antibodies.
got it.
Basically, its own little defense force.
So if the real virus ever shows up, the immune system's ready to fight back.
Exactly.
That's pretty amazing.
Yeah.
What's the recommended schedule for these CDV vaccines?
Puppies usually start their vaccination series around 6 to 8 weeks old.
Okay,
They'll need boosters every few weeks until they're about 16 weeks old,
okay,
and then regular booster shots throughout their lives, usually annually or every 3 years,
got it.
depending on your vet's recommendation and the specific vaccine used.
So it sounds like a lot, but those early weeks are really making sure their immune systems are primed and ready.
Right.
So I'm hearing a lot of protect your pup messaging here, and rightfully so.
Yes.
But you mentioned earlier that CDV affects wild animals too,
Yeah.
even marine mammals.
Yeah.
That kind of blows my mind.
It really highlights the interconnectedness of animal health.
Right.
Outbreaks in wild populations can have devastating consequences,
Wow.
even threatening endangered species. So protecting our pets isn't just about them,
Right.
it's about the bigger picture.
That's a really powerful point.
Yeah.
Protecting our furry friends at home is a step towards protecting the wider animal world.
Absolutely.
We've covered a lot of ground here, from the virus itself to those crucial early symptoms and the power of prevention.
Yeah, we have.
But there's more to uncover in our deep dive into canine distemper.
Welcome back to our deep dive into canine distemper.
Thanks for having me back.
We've been talking about how this virus can really wreak havoc on a dog's body and how crucial early detection and treatment are.
Yeah, and I think, for a lot of dog owners, the assumption is that once a dog recovers from CDV, they're, home free.
Right.
But we touched on the possibility of long-term neurological damage.
Right.
Can we kind of unpack that a bit more?
Sure.
What does that actually look like?
It's one of the most heartbreaking aspects of this disease.
Yeah.
Even after a dog pulls through that initial illness,
All right.
CDV can leave lasting neurological scars.
So it's not just about survival.
Right.
It's about quality of life afterward.
Exactly. We're talking potential persistent seizures,
Wow.
trouble with coordination and balance, muscle weakness, even changes in behavior and cognitive function.
Yeah.
Imagine a dog who was once playful and energetic, struggling to walk or remember commands.
That's incredibly sad, and I bet incredibly difficult for owners to kind of, witness and go through.
It is.
It makes you realize just how high the stakes are with this virus. I was reading about something called old dog encephalitis.
Right.
Can you tell me more about that? It sounds a bit like a scary sequel to the CDV story.
It is a bit of delayed reaction, unfortunately.
Yeah.
Old dog encephalitis usually affects older dogs,
Okay.
often years after they have seemingly recovered from CDV.
So the virus is kind of like a sleeper agent hiding out in their system.
In a way, yes.
Wow.
It's believed to be a reactivation of the virus that's been lying dormant in the brain.
Oh, God.
And it can cause a whole new set of problems.
So what kind of problems are we talking about here? And how do you even know if it's happening?
It's tricky
Okay.
because the signs can be subtle and often develop gradually.
Right.
You might notice changes in behavior, things like confusion,
Okay.
disorientation, maybe even aggression.
Right.
And then there are physical signs too.
Okay.
Seizures, muscle tremors, difficulty moving, and problems with coordination.
It's like the virus is kind of taking like a second swing
It is.
long after you thought the fight was over. That's heartbreaking.
It is.
And it makes prevention, even more critical.
Absolutely.
We've talked a lot about vaccines, but are there other things dog owners can do to minimize their dog's risk?
For sure.
It feels like a multi-pronged approach is needed here.
Absolutely. Vaccines are our frontline defense,
Yeah.
but we can't stop there.
Right.
Being mindful of potential exposure is huge.
Okay.
If you know CDV is prevalent in wildlife in your area, be extra cautious.
Yeah.
If there are a lot of unvaccinated dogs in your community, limit your dog's contact with them, especially if your dog is a puppy or has a weaker immune system.
So it's about thinking proactively and minimizing those high-risk interactions.
Absolutely.
It sounds like common sense, but it's easy to forget when you're at the dog park and your pup is, just itching to play.
Right.
And don't underestimate the power of good hygiene.
Yes.
Regularly cleaning and disinfecting your dog's living spaces, their food bowls, toys, bedding can make a real difference.
Absolutely.
And, simple things like washing your hands thoroughly after handling other dogs
Yes.
can go a long way in preventing the spread of the virus.
It can.
So those basic hygiene habits we've all learned, are just as important for our furry friends.
They are.
It's all about minimizing those, chances of encountering the virus.
For sure.
So what about the duration of immunity provided by the vaccine? Is it a one-and-done thing?
Right.
Or do those initial puppy shots wear off?
It's a great question, and there's actually some debate within the veterinary community about how long that immunity lasts.
Oh, right.
While core vaccines, like the one for CDV,
Right.
are considered highly effective, the need for booster shots and their frequency is something you should absolutely discuss with your vet.
So it's not as simple as just following, a set schedule.
Right.
There's more nuance to it.
Exactly. A good vet will take into account your dog's individual risk factors,
Okay.
lifestyle, potential for exposure, and recommend a vaccination plan that's tailored to their specific needs.
I love that it's about, personalized care,
Right?
not just a blanket approach.
Yeah.
Speaking of personalized care, let's shift gears and talk about what happens when CDV is suspected.
Okay.
Earlier, we mentioned all those tests vets use.
Right.
Can we break those down a bit more?
Sure.
I think, understanding how these tests work can be really empowering for dog owners.
Absolutely. Let's start with the blood test for antibodies.
Okay.
It's one of the most common tools vets use in diagnosing CDV. Remember those antibodies we talked about?
Yes.
They're the immune system soldiers,
Okay.
specifically designed to fight off the virus.
Okay.
The blood test is searching for those soldiers, those telltale signs that the body is battling CDV.
So it's like a head count of the immune system's troops.
Yeah.
Seeing how prepared they are to fight.
You got it.
Awesome.
And there are different types of antibodies, IgM and IgG.
Okay.
Think of IgM as the first responders. They show up early in the infection. So finding them suggests a recent or active infection.
Yeah.
IgG, on the other hand, are more like veterans. They stick around for a long time after exposure, indicating that the dog has encountered the virus at some point, but not necessarily that they're currently battling it.
Okay, so IgMs is like the early warning system.
Yeah.
And IgG is, the memory of past battles.
Right.
Makes sense.
Right.
Are blood tests the only tool in the diagnostic toolbox?
Nope, there's more.
Okay.
Sometimes vets will examine cells under a microscope,
Right.
looking for what are called viral inclusions.
Right.
These are clusters of the virus itself,
Okay.
hiding out inside the cells.
Wow.
It's like catching the virus red-handed.
That's a pretty powerful visual, like a microscopic stakeout.
Exactly.
What about those high-tech tests you mentioned earlier, the ones that detect the virus's genetic material?
Those are called PCR tests.
Right.
And they're incredibly sensitive.
Okay.
They can often detect the virus very early in the infection, even before symptoms appear.
Wow, that's amazing.
It is.
It's like having a superpower to see the virus before it even makes its move.
Right.
This is all really fascinating stuff, but I can see how it can, get overwhelming for dog owners.
Yeah.
What's the key takeaway here?
I think the most important message is this.
Okay.
If you suspect your dog might have CDV, don't wait.
Right.
Get them to a vet as soon as possible.
Right.
The sooner the virus is detected, the sooner treatment can begin, and the better the chances of a positive outcome.
Early detection is everything.
Yes.
And remember, we've got all the information we need to be proactive and protect our pups. And we're back, ready to wrap up our deep dive into canine distemper.
That's right. And we've really covered a lot of ground, haven't we?
We have. We've explored the virus itself, those telltale symptoms,
Yes.
the importance of prevention,
Absolutely.
and even how vets use all those different tests
Right.
to confirm a CBV diagnosis.
Yeah.
And I think for a lot of dog owners, those tests can feel a bit like a black box. You get the results, but you're not quite sure what they mean.
Right.
So let's try to shine a light on that a little.
Yeah, for sure.
Let's talk about how to actually decipher those test results.
Absolutely. Knowledge is power,
Right.
especially when it comes to advocating for your dog's health.
Exactly. So let's start with those blood tests.
Okay.
They're looking for antibodies, right? those little soldiers that the immune system sends out to battle the virus.
Right. And remember, we talked about two main types of antibodies, IgM and IgG.
Right.
IgM is like the alarm bell.
Okay.
It shows up early when the infection is active.
So if the IgM levels are high, that's a pretty clear sign that the dog is currently fighting CDV.
It's a strong indicator, yeah.
Okay.
But vets also look at IgG levels.
Right.
IgG antibodies stick around longer, even after the initial infection has cleared.
So high IgG levels could mean that the dog was exposed to the virus sometime in the past,
Right.
but isn't necessarily sick right now.
Exactly. It's like a scar, a sign of a past battle.
Okay, that makes sense. So by looking at both IgM and IgG levels, vets can kind of get a better picture of what's going on with the dog's immune response.
They can.
What about those microscopic examinations? What are vets actually looking for there?
They're searching for what are called viral inclusions.
Okay.
Basically little clusters of the virus inside the cells. Imagine looking through a microscope and seeing these tiny groups of viral particles.
Wow.
Pretty clear sign of infection.
It's like catching the virus in the act.
It is.
And what about those PCR tests?
Right.
The ones that analyze the genetic material.
PCR tests are incredibly precise.
Okay.
They can detect even tiny amounts of the virus's genetic material in samples of blood, urine, or even cerebrospinal fluid.
Gosh.
And the amazing thing is they can often identify the virus very early in the infection, even before symptoms appear.
Wow. That's like having a superpower.
It is.
It's like finding a needle in a haystack,
Yeah.
only the needle is a tiny virus.
Right.
And the haystack is your dog's entire body.
It's pretty remarkable technology.
Yeah.
And having these diagnostic tools available means vets can make faster, more informed decisions about treatment and management.
It's like having a whole team of experts working together
Right.
to protect your pup.
Absolutely.
So we've covered a lot of ground in this deep dive.
We have.
We've explored the virus itself, those telltale symptoms, the importance of prevention,
Yes.
and even how vets use all the different tests to confirm a CDV diagnosis.
Right.
And I think most importantly, we've emphasized that knowledge is power when it comes to protecting your dog.
It really is. Canine distemper is a serious threat, but it's a threat we can face head on.
Right.
We have vaccines, we have diagnostic tools, and we have the information we need to make informed decisions.
Absolutely.
So stay vigilant, keep those vaccinations up to date,
Right.
and don't hesitate to reach out to your vet if you have any concerns.
Early detection and intervention are key. Well, that about wraps up our deep dive into canine distemper. Thanks for joining us today.
Thanks for having me.
We hope you found it insightful and empowering. Until next time, stay curious and keep those tails wagging.